this other person in. We're excited to have you guys all trickling in. We understand that you are in between lunch, so we're excited about spending lunch with you during this amazing, amazing time. So 1 minute here, and we will go ahead and get started and go from there. Well, hello, everybody. Welcome. It is Wednesday. I am so excited to bring to you one of our new amazing partners, one of our lifetime partners. A lot of you asked about them, and they're here. So this is your chance to ask questions. Make sure that you're involved. Get in the game. This is not just about us. It's about you guys as well. So we're excited. I'm going to go ahead and bring and introduce myself. All right. I am president and founder of African American Women Trucking Association. Excited to bring you partner connection resources. This is how you thrive. This is how you survive. This is how you grow. This is how you learn. It's about education. All right. And so if you're here, you're wanting to grow, you're wanting to learn, whether it's expanding your business or expanding your resources, this is how you do it. All right. Sometimes it's not about you. Sometimes it's about who you know. All right. And so now you have a resource to be able to pass on, all right, for information to be able to pass on and hear it from the source. So for those of you that are members, this is what you're member. This is why you're member. All right. This is why we community, so that you're able to get the information that you need, pass on to your organizations, pass on to, to your drivers, to your carriers, to your employees, whoever it may be. So I want to introduce to you Hope and Ty and Dr. Joe. I'm excited to bring them on. They have something amazing for you. So get ready. Feel free to interact. I'm going to always say, hey, if you're a member, please make sure that you tell us that you're a member in the chat. If you're a guest, let us know that you're a guest as well. Please also drop your information. All right. So we want everybody to be able to share their contact information. Hope's going to do the same. Ty's going to do the same. Joe's going to do the same. All right. So they'll be reaching out to you afterwards. So we can't do that if we don't have your information. All right. So I'll do the same as well. Let us know. You're a dispatcher. You're a driver. Are you behind the desk? Are you behind the wheel? Let us know. All right. So we're excited, and I'm going to hand it over to Hope. We're so happy to have you guys here. Hope, introduce your team and welcome.
Hello, everybody. My name is Hope Savara. I am the CEO and founder of Mother Trucker Yoga, and I've been in the trucking industry for going on 9 years. And when I first started in the industry, I really saw a huge gap, and that gap wasn't just having more wellness programming or having more health options for truck drivers. Really, the gap that I saw was this disconnect with health insurance when it came to trucking companies, fleets, carriers, logistic companies, that there was this disconnect between health coverage and your actual health, like your actual health and well-being inside not only the healthcare itself, but within the companies that healthcare was covering. And I had the opportunity 2 years ago to team up with two incredible people in their organizations, Dr. Joe Duggar and Ty Mayberry, and they're here with me today to really talk more about how it is that we can transform health and wellness in this industry from a health insurance perspective, how you can bring wellness under one roof and really transform the current coverage and the current approach to coverage that you may have. That includes kind of turning this telehealth model that we were just kind of dumped onto when 2020 came around with COVID, thinking that that was the only option. And I've talked to hundreds of drivers that don't use it or feel like it's not the care they're looking for. And Dr. Joe is here today to talk about a new approach that can really transform not only the care that your employees are getting or that you're getting, but also it can be a huge savings for the company or your company that you work for when implemented correctly. And so we thought it would be super easy and fun. We're going to kind of do a little bit like an interview format or question and answer between myself, Ty, and Joe, and then we're going to open it up for questions afterwards. So if you have questions, drop them in the chat, and we'll definitely try to get to those, or just write them down, and we'll definitely take those questions at the end. And I want to start with Ty, because Ty is kind of like the top of the umbrella with what Joe and I are doing for trucking companies, carriers, logistic companies, when it comes to the health coverage side. And so Ty, do you want to just first like really briefly tell everybody what you do? And then I have a really great question I want to kick off asking you.
Perfect. Thanks, Hope. And thanks, Nicole. And thanks, everybody, for taking the time to be on this call. And for those of you that are going to watch this later on that couldn't join us, first thing I want to do is make sure that everybody knows that once we get this out, we will be sending and posting it with Nicole and her team, all of our information, all of our contact stuff. You can find us online as well. So we'll give those links. We actually have a trucking association landing page for you guys as well that we'll get out to you all. But again, myself and Ty Mayberry, I have been in the insurance business for almost 19 years. I started off on the voluntary side and then grew in about 10 or 11 years ago, grew into the major medical side. Ended up helping grow a large regional agency in Missouri. We sold that back about 8 years ago. Since then, I started my own insurance agency and we've grown it. We are a full service insurance agency. AAWTA Advisors handles everything from the major medical and employee benefit side all the way to additional life insurance and ancillary stuff to property and casualty liability insurance. So today we're talking more on the lines of the major medical side and employee benefits. We specialize in truly just having new and innovative ways for businesses to save money. And what we do is we specialize from small to large stuff. We have clients all over the board from thousands of employees down to 3 and 5 employees. But our goal when we started when we started that's another one of my companies, but when we started AAWTA Advisors, we wanted to be able to really help businesses in a time of increasing cost and benefits and major medical costs, all that, try to find new and innovative ways to help save them money. And we have done a very, very good job. We've got programs in place to do that. So that's kind of my background. We have some technology that we've developed as well that really help companies evaluate what their current benefits are. So we would be happy to really start showing and helping your members what we do and how we can help their businesses.
Awesome. Well, I want to kick it off, Ty, because whenever I talk to people about health insurance, like I'm literally on their side of the table because I did not come from that background. I'm not a doctor. And so I'm kind of like learning right alongside of them. And this has been life-changing for me because I'm learning so much more than I ever knew before. But for a lot of people, they just have this coverage and they think, okay, yeah, I have coverage. My employer gives me this. Like, I think this is good, right? Or they're an employer and they're like, well, this is what I was told are my options. So what is like one of the biggest misconceptions? Because I have a couple questions I want to get to you with. So what's like one of the biggest misconceptions that people have about their current health coverage, whether it's an employer or an individual? You can tackle one or the other.
So that's kind of a two-part. Number one, a big misconception right now is that every year major medical insurance is going to go up on you, whether it's you as a business and what your costs are or what the employees' costs are. We put things in place to truly try to reverse that cycle. It's become very, very common in the industry that, and whether it's major medical companies or in carriers or your current broker, they've become accustomed and it's been normalized that insurance costs continue to go up every single year. And with the right programs in place, we actually can get that to trend backwards. We have cases every single month that we do that are trending backwards once we take them over. Sometimes that's not for the very first year, but certain programs will start to work that cost backwards. So that's probably the biggest one that we run into is we have a lot of businesses. Yep, we got a 10% increase this year. Thank gosh it wasn't a 13 or a 15 like it was last year. And so we really try to dive in and put programs in place that help utilize claims and divert some of those to where, and just other programs, other benefits in place that truly try to trend that backwards.
So one term I've heard, and Nicole, you probably have heard this before with your background, is that people talk about shopping plans. And I know advisors even shop plans for their clients, no matter how big the company is. So how do you approach helping clients differently than just like, I'm going to shop the marketplace, or I'm going to shop plans this year? And this was a eye-opening thing for me when I first started working alongside of you, because that's kind of like, I don't want to call it the scapegoat version, or like kind of the easy street version, but like, I know you have a different approach than just shopping plans and being like, here's what your options are. Can you talk a little bit about that?
Yeah. So one of the biggest things, and again, there's a lot of great brokers around the country, but a lot of brokers that have been in the business for 20 and 30 years, they've gotten just accustomed to, well, they got a 20% increase, I'm going to go ahead and shop it. And what they do is they will shop it with other, what we call BUCAs, the Anthems, the UHCs, the Allstates, the biggest insurance carriers in the country. And what we've found with that is that's not always the best option. And health insurance has gotten so complex, and there's so many players in the game now. And even different types of major medical plans. So what we do is we truly evaluate. Number one, we evaluate what you're currently offering. We really dive into your claims and making sure that we have claims reports for you, and you're in a program that can do that. If we cannot view your claims, and you as a business cannot view your claims, and what is being spent on claims each year, there is no way to ever monitor and manage your major medical cost. So we take a different approach when we do get clients, or even looking at new clients. We dive into their claims quarterly, at least quarterly. If we have a client that's in that we take on that is in a bad situation where they have a lot of high claimants and there are a lot of high pharmacy and stuff like that, we do everything. I mean, we'll go monthly if we have to truly just kind of to get a grasp on what they're running into cost wise. And try to manage that quickly. I look at it's better catch it the first or second month this happens, instead of a month or two before your renewal. So you've gone 9 or 10 months and it's been like that. It's already affected your entire year, and so that affects your renewal for the next year. We dive into pharmacy as well. We try to find if somebody has a company that is got really high pharmacy cost. There's a ton of partners out there and vendors that actually help with pharmacy discounts and different programs that can drive down costs in some aspects, sometimes 70%. So our approach is not the traditional, well, we'll just shop it with this, and this is your only 3 options that you have. We go as deep as even looking at changing up the plan and what type of major medical it is. You have fully insured, which is the most expensive plans you can have out there in the country now. You have level funded and self-funded products that are kind of a combination of all 3 in some aspects. So we really dive in and really find a plan that best fits you and your employees and keeps the same great network that you guys are used to. But that's the biggest thing that we try to do.
Okay, so this is a question that I had, and then I know other people have had. Joe and I have had many conversations with trucking companies over the last 2 years. Like, where are people typically overpaying in their current health plans? Because I feel like what's happening for a lot of employers, and this is no fault to theirs, is they see that they're overpaying, and their response is to pull back on coverage. Is to either raise deductibles or to adjust things where now the employees are getting less. So where are people typically overpaying in their current health plan? And this is going to lead me to the next question.
So for us, when we get a client that is trying to pull back, we dive in further. We want to dive in further and figure out programs to truly help navigate through some of those difficult things. But a lot of that comes from, again, sometimes brokers don't do their full due diligence to create a plan that is truly customized for that business. And when you have individuals like somebody in trucking association, we've got a lot of trucking companies that we insure on the major medical side, And with that, we just go in and find programs that reduce costs for the employer and the employee, but even in most cases, we add benefits. So when we take over a client, we normally add a ton of benefits by keeping the same plan structure in place. Now, are there times where you do need to raise that deductible a little bit to put a little bit more back on the employee because they're used, sometimes in some situations, employees are running straight to the ER instead of going to urgent care. So our biggest thing is we try to educate employees and the business on how to use their major medical and other options to divert some of those claims to other programs. But in most cases, we're able to find where those extra expenses are. A lot of it's pharmacy. A lot of it is just truly a broker not shopping it like they should. And sometimes with a business owner, it is sometimes easier to say, darn it, it's 12% again. I don't have time to do it right now, so we're just going to leave it. Or they decide instead of leaving it, it's costing too much and pull it back. And when you pull it back, what happens is you lose employees or you lose interest in the benefits. The employees now say, well, the benefits aren't that good. I don't even want to participate in the major medical. So it's kind of it starts a trickle effect that is not good normally.
So like for people that are listening and people that are on listening afterwards, what are red flags that would indicate for someone that they maybe have a poor, outdated plan, and this would be a really good time to have a second set of eyes, be it maybe your team, take a look at it? Because one of the conversations I know Joe and I have had with different trucking companies is, they're really worried about the current broker they have, but at the same time, they know they're paying too much and they know that there are issues. But like, what could be something that someone could just look at their plan and go, okay, yeah, I remember Ty saying that, like, that is a red flag.
Yeah, so a couple things. Number one, if they have not shopped it with another company in 3 years, if you've had the same exact Blue Cross or Anthem or United Healthcare for 3 years, and your broker has not truly just went out and shopped it and checked and to make sure that you guys are in the good. Also, if you've got a decent sized business and let's say 20 plus employees, and the higher that gets, this part's the most important, but the higher this number gets in employees, the more important this is. But if your broker is not talking to you about your claims utilization, that is a huge red flag that you as the business owner, not that you're getting any kind of personal information on your employees, HIPAA protects all that stuff, but you do need to know if you have a ton of high prescription cost, if you have things like heart attacks going on, large. And the other thing about that is for us is we want to see it because health insurance companies are really good about going into that renewal the next year after that heart attack happened or say a cancer situation happened, and they're still charging you for that same person that may have had treatments all year and now they're in remission. We dive into the renewal and make sure, and I've got actuaries that work with us. We have underwriters, so we dive really deep into it. But we want to make sure that they're not still charging you each year for that cancer claim that is now over. They like to roll that into the next year to whether it's to get their money back or whatever. But we negotiate and fight for you guys. The other red flag, and I'll get through this pretty quick. The other red flag would be if you are receiving your renewal within 30 days of your effective date or your renewal date. That is a red flag due to most renewals come out either at 60 days or 90 days to your broker, and it's available. So the way I look at that and my team looks at that is if I see that renewal at 60 or 90 days and I see that it's a 22% increase, or it's a 8% increase. It does not matter to me what it is. I look at it. We get that out to our client immediately because for me, if I'm going to negotiate with that carrier or other carriers and shop you guys, I want to make sure that I have negotiating power at that time. They know we have plenty of time to leave and to make changes. If you're getting it 3, 4 weeks, 2 weeks before your renewal, and it's a 13% increase, any double-digit increase should be shopped every single year, in my opinion. That's what we do for our clients. But not that it's not justified sometimes, but we definitely make sure. But if I go to the carrier at 3 weeks or 2 weeks and say, hey, we want to negotiate this rate, it's too high, they know we don't have time to switch. So I have no negotiating power, neither does the business. So they know that you're hooked. And I just ran into a big company the other day that they still haven't received their renewal. They're wanting us to shop it, but they're 2.5 weeks out from the renewal, and their broker, and it's a large company. But again, in this instance, some of you may have great relationships with your brokers, and they may be a friend, a family member, but even at that, unfortunately, sometimes they kind of get comfortable and they don't continue to shop it and look at it. So what we do is we're happy to look at it for you and help you. I can normally look at a renewal immediately and know if I can help you or not. But I do know if we don't help you with the major medical renewal, there's other benefits that we can help you with that adds to your package, with leaving all of your major medical alone too. So in that, I definitely, I want you guys to know that if anything about our agency, and we're located all over the U.S., but the biggest thing about our agency is my people and myself and my agency is never going to talk you into leaving your current broker unless it makes 100% sense for you guys. I respect that you guys have a relationship with them. There's, in order to work with us, you got to fire somebody, it seems like sometimes, on the major medical side. Now, outside of major medical, there's a lot of other things that we can do for you and not touch your major medical. But that's probably the biggest thing I would say is if you're getting renewals within a couple of weeks or within 30 days of your renewal, that's not a good sign, because you lose all negotiating and bargaining power.
Well, something you said kind of leads me over to Joe, and you were talking about, there's other things outside of major medical that you can do to improve employee health, improve coverage, improve your bottom line, all of that. And Dr. Joe Duggar is here with One Life Direct, and he's one of our partners in this. And he is really bringing forth a model that is getting some coverage. We found a couple articles on it in the last couple months. And that's this direct primary care or virtual primary care model when it comes to taking care of employee health concerns. So a lot of us on this call are familiar with telehealth. It's been around for a couple of years now. Basically, you call up, you have no idea who this person is. They have no idea who you are. They're trying to help you. And then all of a sudden you have a question, you call up again, and it can be somebody totally different. Obviously, I'm very much summarizing that. There's a couple different models out there. But what virtual primary care and direct primary care do is really create a really great solidified relationship with your doctor, no matter where you are, coast to coast, giving you kind of that concierge service. And from an employer standpoint, this is a huge cost savings because of the type of care that the employees are getting. And so, Dr. Joe, introduce yourself briefly, and then can you tell us what exactly direct primary care is and how it would work for someone in the trucking space?
Yes, thank you, Hope. Yeah, it's great to be with you all. So I'm Joe Duggar. I'm a medical doctor, and my clinic is in Central Arkansas, but I've been in medicine for about 30 years. I've been in direct primary care for over 7 years now. And I went to direct primary care because of exactly what Hope's talking about, just the lack of access to care, the lack of personalization, the lack of time to be able to spend with people, to get to know them and know what they need. All of that drove me into this model. But yeah, as far as the trucking industry goes, some of the very first companies that I started working with when I went into direct primary care were small trucking companies. And I really noticed how beneficial it was for them to have the access to us, 24/7. And that's one of the big reasons that people go into direct primary care as a consumer, as a patient, because you can essentially communicate with your medical team at any time. Most of my interactions are by text, but certainly phone calls or telemedicine. We do all of that, but we can deliver care a lot more efficiently when people need something, we're available to help them get what they need. And if they're traveling, it's not any different than if they're 2 blocks down the road from our clinic, because we can just respond to the text. We can find the closest pharmacy if they need something at a pharmacy, or the closest facility if they need to be seen. But really, it allows us to not just give lip service to the idea of wellness, because we're able to have so much more bandwidth to really get to the essence of what does this person need, and not have to just shuffle through what I call assembly line medicine, where you're trying to see 30 to 40 people a day, and just try and pay the light bill with that model. So we see a lot of people's health transform over the course of a year or two, after they get used to not delaying getting the care they need, because that's really the biggest problem in our system right now. Hope is the delay in care. For various reasons, we put off going in to see the doctor. A lot of that's because of access. It's just not available. You can't get an appointment that day, or it's going to cost you a lot of time and money. And so it's all those things. But we eliminate those barriers, and it's really simply, send me a text, give me a call. It's very simple to get to us and get what you need. So
So
go
I actually
ahead.
spent a couple of days with Joe at his home and with his practice several months back, and I got to witness this firsthand. And it really is a remarkable model, because if you have a problem, and this is not just directly with Joe, he has a team and a network of people he works with, but with the direct primary care, virtual primary care model, you have a problem or you need a scan or you need to see a specialist. It's not get a referral, wait 20 days, go do this, jump through hoops, give your firstborn son, like all of that. There's not that process. It's call your primary care provider, which in this case is Joe, or text him and say you need this, and the appointment is made, or the referral is given, or they're waiting for you at X clinic. Like that middle kind of circus act that we've all just been accustomed to thinking that this is healthcare, is kind of eliminated in this model, which is really fantastic for drivers, because they don't have time for that. They have 3 hours and they have this issue going on and they need help with it, or they're out of medication. They have one opportunity to get off in this town and pick it up. What do? And that really is kind of this like direct response model. And I got to witness that firsthand with being with Joe for, 24 hours a day for a couple of days in a row. I got to see that firsthand, how that was playing out with a variety of patients. Obviously from a distance, I don't know anything about their medical, care, anything like that, I want to assure you. But I really got to see this firsthand and how different of an approach it is. And for an employer to be able to take this model on, it just means your employees are in the driver's seat longer. It means less sick days. It means better care. It means health coverage when you need it. And it really means that wellness and health are on the front end instead of on the back end. So Joe, my question for you is, how does direct primary care improve access and quality of care? Can you give some specific examples?
Yeah, absolutely. So obviously, being able to text your doctor is a huge benefit. And when people have something come up, if it's appropriate for us to have them come to the clinic, we can tell them pretty quickly what needs to happen. If someone's having chest pain and they're trying to decide, should they call the ambulance, should they go to the emergency room, we can help guide them with that. They'll text us and we'll say, you need to go to the emergency room. We'll get them where they need fairly quickly. But we don't have a list of 30 people that need to be seen on a certain day that causes it to be a problem for someone to get in same day if they need it. So it's really the bandwidth, so to speak, is much greater for us than what we would have in a traditional model. We don't collect copays. We don't charge for office visits. It's all subscription based. So and from the employer side, we do a lot of the um, workman's comp and on the job injury type of services for them, and it just saves companies money across the board because they have the ability to let us know that someone's been injured on the job, and what the situation is. We can see them that same day, that same hour, a lot of times if they're close by the facility, and we can help them determine what the best next steps are. So if they need to see a specialist, if they need imaging, we can direct all that. And we have sort of a similar system with our specialists and our imaging, our labs, the things that need to be done outside of our facility, where we have direct relationships with them, sometimes contracts with them, but it's at a discounted price. It's at an expedited um, service, so they can get in fairly quickly, usually, to get those things done. So in every sense, we're saving time and money for the patient.
So question for you, and this is something that I kind of learned, and this is why we partnered up with Ty. So can direct primary care, this type of model, this is actually a two-part question. So the first part of it is, can you use something like, if I'm an employer, I have X amount of employees, and let's say some of them have a doctor that they love, can they still use this model, this type of health support in addition to their doctor? Like, can they keep their actual doctor, or is this like, you got to abandon ship? I can't see Dr. Stickney anymore. I have to see Dr. Bill. Like, how does this work?
Yeah, absolutely. You can keep your doctor, and that's what we encourage all of our patients to do. If you're even in our vicinity of where the clinic is located, we'll fill in the gaps for those patients when they can't get in to see their doctor that day, or it's an evening or a weekend. And we coordinate that care when we need to, and we help facilitate communication to their doctors when there's been care given outside of their normal medical team. And so we're able to support and really fill in whatever way we need to make sure they get what they need in a timely way.
So how can this be paired with insurance plans? Like, just a brief synopsis, like, how does that work?
Well, I'll say this, and then I'll let Ty respond to that too, because he's more of an expert on customizing these plans for employer groups. But when you put a direct primary care um, component into an employer-based health plan, you're going to save money, substantial money, and on the low end, probably 15 to 20%. But a lot of these groups are saving 50%, 70% in some cases on their annual spend. And so a lot of that's because a big cost in a plan is for primary care office visits, and ours is a subscription service, so it's a fixed cost monthly. There's no variance there, and then there's the elimination of the extra copays, deductibles, that kind of thing. But we save companies and employees a lot on ER care, urgent care, um, imaging, labs, all those things, because we're able to accommodate a lot of those issues that come up after hours or on weekends, with simply texting and communicating directly with them and fostering that relationship where we know them, we've got their medical records, we've interacted with them multiple times, so we can relate to our patients much better because there's a relationship there, and we have an understanding of what they need because we spent time with them. So
Essentially, instead of going into the ER every time something's wrong, if you're out on the road, this is kind of that middle, like, I guess, side street to that, to save employers a lot of money. But also, I think for the employee, a lot of time, energy, and money as well, co-pays, time off, stress, all of that, to be able to call someone or video chat with somebody that knows you, has your chart, is in communication with you, and can help you kind of make those next right decisions. Ty, do you have anything like 60 seconds to add to that?
Yeah, really quick. One of the best things about Hope and Dr. Duggar both is they take more of an approach of functional and really not, so many facilities, medical facilities now immediately say the first thing the employee needs to go do is get on medication for that situation they're going through, or that maybe that injury, or you got to go have a knee surgery right now, instead of going through, lifestyle exercises and maybe changing diets and things like that. Like it really helps divert cost as well. Every time you have an employee that goes and gets a surgery or another prescription, that's not truly fixing a problem in most cases. And 85% of the cases, you don't have to take that prescription. You don't have to go straight to a surgery. So by implementing a program like the direct primary care or virtual care or lifestyle coaching, it truly takes away cost down the road for your major medical plan and what that plan will incur. So that's probably the biggest thing. The ROI on that is incredible. And that's just one of the things that, again, we dive in a little deeper. We have partnerships like this together that really, and for the trucking community, it's a huge thing because you have people on the road and the conception is they're only limited to, going to a doctor here, going to a doctor there. I only have to take medicine because that's all I can do. I don't have the ability to exercise, which these guys have come up with an entire program around wellness, driving a truck. So it's phenomenal. I'm really excited that you guys as a organization have access to us now. And this stuff will start changing not only employee behavior, but employee morale by having additional benefits, and really start pushing costs back for your companies.
Awesome. Well, I want to just wrap up this and then we'll move to Q&A. And so the reason why myself, Hope, with Mother Trucker Yoga partnered with Ty and Joe is because for these 9 years that I've been in this space, everyone just keeps talking about health and wellness. They add wellness programs to their company, which I think is great. We do all sorts of different campaigns and challenges, but yet nothing's changing. Nothing is getting better. And so really trying to say, okay, step back. What are we missing? And the piece that I saw that we were missing was that wellness was over here. I'm talking like wellness programs, health coaching, fitness stuff, all that stuff. And then healthcare was over here. And they never communicated. Think about that for a second. They never talk. Like, never once did I have a conversation with somebody like Joe that's also seeing the people that I'm also helping. Never did I have a conversation with someone like Ty when I'm like, hey, these are the things I'm seeing the people that I'm helping are dealing with. Why are they paying through the nose for this stuff? And now they feel like they can't afford a simple program that focuses on lifestyle wellness. And we really came together to say, well, why can't all of this be under one roof, where we're all working synergetically to help the patient? And so many of you are in a model that is money-centric focused. We created a model that is patient-centric focused. And what we mean by that is that you are at the center. Yes, we're trying to save you money. Yes, we're trying to make sure you have the best plan possible, have good access. But ultimately, we actually want you to get better. We want you to be off as many medications as possible. We want you to lose the weight. We want you to use lifestyle. We don't just want to be like, hey, here's some things you can take and that'll make your blood pressure lower. Well, let's ask ourselves, why do you have high blood pressure to begin with? Why have you put on this weight? Why aren't you sleeping? And let's kind of peel back the layers, get you help now that you need temporarily, but then let's really try to adjust the root problems. And we can't just do that just in healthcare. And we can't just do that just in the wellness space. We really need to work together. This is a synergetic type of approach that needs to happen. And so at Mother Trucker Yoga, we really focus a lot on what I like to call lifestyle wellness. What that means is this is not about being the fittest driver or the fittest person on the planet. This is not about running a 5K. This is not about only eating organic or things that are green for the rest of your life. This is about trying to create a realistic approach to your lifestyle, your constraints, and your goals, and being able to create a sustainability to get there with the support that you need. People like Joe, with plans like what Ty offers, and being able to move forward in unison, not where there's something over here and there's something over here. About 2 years ago, I interviewed 18 different trucking companies from 100 drivers all the way up to 4,000 plus drivers, some of the biggest ones in the space. And they all had one thing in common. When I asked them about their wellness programming and how many drivers were accessing it and utilizing it, unanimously, pretty much all of them said around 1%. And the biggest reason for that was because the approach to wellness has been backwards. It's this thing that is like, hey, you need to do this. You need to be a part of this. Here's 90 things you need to be a part of now that we have a wellness program at our trucking company. And for a driver, they're like, oh my gosh, like the last time I did fitness stuff because I'm busy was high school gym class. And I'm not saying that to be funny. I'm saying that because you're busy. Like you have a lot going on. And so to be able to approach that more realistically in a step-by-step process with the health side supporting you, this can really make all the difference. And when the numbers work, meaning for a company, because you got to stay in business, right? This becomes a much more approachable, acceptable, and digestible type of a plan that can really not only save you money, but save you time, energy, and save your health. Because last time I checked, replacement parts are never as good as the originals. And so we want to try to preserve this thing to the best of our ability so that we can keep on trucking and do what we need to do. And Ty, Joe, and I can do what we're really good at, and that is help you with your health from start to finish, top to bottom, 360-degree round. So we want to open it up to anyone that's on today. If you have questions, we'd love to answer them to the best of our ability. It can be about your health coverage. It can be about direct primary care. It can be about wellness. It can be, I have this toe fungus, what do you think? We might not be able to answer that, but, something along those lines.
Good morning, everyone. My name is Tamika Willis with AAWTA. I have a question. Do you guys offer an app that the drivers could actually be able to tap into when we talk about the wellness and the different avenues that they can take to do maybe preventative health and different things like that? I think that would be a great one because being in different organizations and associations, that was one of the things that a lot of the drivers kind of stressed with it. And so I think having an app, being that they're busy, especially, I've been in the trucking industry for about 12 years. And those are one of the things we get kind of busy, but having that app and being able to tap into it, I think would be a great tool for the drivers to really be able to do to kind of when they have that downtime and they have to shut down, that they can kind of go over and see what all you guys offer and what would be more beneficial for them at that time.
Yes, we do have an app, and so drivers can access all of our videos, our audios, our downloads. We have a community chat. We have a lot of different amenities there. We're always growing and expanding it. I'm personally working on it right now to kind of upgrade to another platform just to be able to expand even more. And so that's kind of in the works and process. But absolutely, being able to have something at your fingertips can be transformative for a driver, which is why I love what Joe is doing as well, because when you need something, it's so much easier to just pick up your phone and drop a text than dial this 1-800 number, wait on hold, hope that you get someone, explain what's going on, explain who you are, explain what your history is, explain all this stuff. It could be like, hey, Dr. Joe, now this is happening with my back, or I'm having reflux. What do I do now? And he knows you, and whoever it is that is on that other end knows you, can make such a big difference in the quality of care and having that accessibility. So to answer your question, yes.
Great question. I wanted to kind of add a comment. We talked a lot about the healthcare side. I think it's very important that we are preparing people mentally for the health and wellness aspect of trucking. I think trucker drivers are so caught up in getting to the next load that they're forgetting that health is wealth. That is how they keep going. That is how we survive. Your body's breaking down. We're not on the road. We're not driving. As an employer, it is important for me to ensure that my drivers are healthy, that they're taken care of, they have access to healthcare anywhere that they are. Okay, not just when they come home, not just during a reset. You know, medicine can't wait. We have so many drivers that are dying. And a lot of it is sometimes they don't have access to their medications because they're on the road. That's insane to me. Something as simple as that. So when I think about one of the things that I was very excited to partner with Dr. Joe and Kai and Hope is because they didn't just have just this program, but they have real solutions, okay, that are proactive, are jumping in front of the issues, all right, putting you in a position to ensure that you have the resources that you need for health and wellness. Hope has some amazing supports for those of you that are, especially if you're catching the replay or you're on here, that I can hope that you talk a little bit more that is fitness related, that's accessible on demand. Hope, can you talk a little bit about some of your programs?
Yeah. So one of the things I recognized when I stepped into trucking, and I think there's some great players in this space, most definitely, was that they were still approaching it from a gym or physical therapy style format. And drivers ain't got time for that. Let's be honest. And the ones that do, cool. They're actually not people that I probably need as clients, or they probably don't need me because they already have that routine. You know, they're running, they're doing all these things. And I love that. I hope they continue with that. The ideal drivers that I'm working with have never thought about fitness and health. They just wake up, do their job, and go home every day. And so the whole premise of what Mother Trucker Yoga, what we do with this concept of lifestyle wellness and fitness, is small little bite-sized pieces of things that you can do in 5 minutes or less. So that could be like you're stopping for fuel and you got a Charlie horse, or you have back pain. Oh, hey, here's 3 videos. You know, I can watch one of them in 3 minutes or less. Oh, I can do that while I'm filling up with fuel. It looks like I'm tying my shoe. Like nobody's going to know. Or, hey, I'm struggling sleeping. You know, here's a meditation, or here's some breath work or some gentle stretching to help you wind down so your nervous system can start to relax so you can fall asleep. Like it might not be that it's the truck's fault or it was a bad day. Like your nervous system may just need to come down a few notches and you're not setting yourself up properly for sleep. And that's why you're not sleeping. Hey, here's a track that I can listen to or I can watch. You know, I want to try to make a few things that are healthier for me while I'm on the truck, but I don't have a lot of access to food. Oh, here's a couple of thoughts. Here's a couple of resources that you can utilize. You know, all of these things accessible at your fingertips with the whole concept of short, easy, quick, and fast. That if you can add 1 or 2 things into your day, the human brain is funny. When you take away, it becomes more resistant. But when you add, it's much more open. And the hope is that, hey, if you're doing this one stretch and you feel better, when you feel better and you walk into the truck stop, you're a lot less likely to grab the donut. You might actually grab a piece of fruit. And you grab the piece of fruit, now you feel good about yourself. Now you go back to the truck, and instead of being mad about your day, maybe you're thinking more positively and you decide to call someone, and instead of complain to them, you're talking about what a great day you're having. And because you did that, now when you go to bed at night, you're more likely to maybe do a couple of stretches or, you know, watch something more on a positive note. Like it's a cycle that we want to get into. That is truly lifestyle wellness. It's not just, I did a 20-minute workout, woohoo, look at me. Like it is really looking at how can we change each step in our lives simply by making one small change consistently. And so this approach isn't glamorous. It's not fancy. I lost 1,000 pounds or 100 pounds plastered all over my website. Although weight loss is a side effect to changing the right things in your life. But what this does do is give people the right tools to take back their life. And to me, that's something you can take to the bank. And so when you have other people in your corner, like Dr. Joe with direct and virtual primary care, and you have a health insurance plan and a team behind you that actually wants to know you and cares about what kind of plan you have and what you have access to, that's where we start to change this industry. That's where we stop saying that we're the most unhealthy, our people die the soonest. Like that's when those types of campaigns start to go away. And instead we have campaigns of resilience. We have campaigns of people that are hard workers and are able to take care of your health. Like that narrative starts to change, but it starts with one small, simple change. And that really is how can I make one small decision today to move closer towards wellness and further away from pain?
That's right. That's right. I love that final closing that you just said, Hope, because that's so important. I can't beat our stress enough. Our health is our wealth, guys. We have to care. You know, we have to care. At AAWTA, we care. We care about health and wellness. Hence the relationships that we have with Dr. Joe, with Ty, with Hope. These things are important. So let's take them seriously, whether you're behind the desk or you're behind the wheel. You know someone that is affected by their health, right? And so what could we have done beforehand, before they were in a position that was so terrible that they had to come off the road, that they, had to retire from trucking logistics? How could we have put them in a position to partner with individuals that actually care and can put something in place to prevent sickness, all right, and to take you off medicine, and just to make sure you're stretching your joints, and just all of those things are so important when it comes down to longevity of being in this industry. All right, so if you haven't done so, please drop your information in the chat, not just for us, but for you guys as well. Your network is your net worth. All right, so if it doesn't apply to you, I know that there's somebody that it does apply to, and now you have access to us, right? Us to ensure that we're able to push whatever it is, whatever the agenda is, your health and wellness agenda. Now we're able to do it as a team. All right, that's part of why you became a member of AAWTA, and that is part of membership, so that you're not going into your health and wellness or any type of journey by yourself. You have a team behind you, and we're here to support you. We're excited that you're in the industry, and we want to keep you here. All right, we want to keep you in the industry. That's what's important. All right, so again, if you haven't dropped your information in the chat, please do so. I'm going to ask Hope and Ty and Dr. Joe to please announce their information for those that are catching the replay that can't see the chat. And if any of the members want to come up and talk and provide your information for those that are catching the replay, by all means, we'll open up to do that. But we appreciate you being here. Again, we're open for questions. We got 5 minutes left, but we're going to go ahead and let Hope and Ty and Dr. Joe announce how you can reach them. For those of you catching the replay, don't be shy. Please reach out to us. We're excited. This is what we're here for. This is what we built this platform. All right, Hope.
Awesome. Well, you can find me at Hope at mothertruckeryoga.com. Or mothertruckeryoga.com. I was really butchering that. Check out our website, Hope at mothertruckeryoga.com would be my email. And reach out to me. Let me know if you have questions about wellness programming, about how you can incorporate wellness programming in with your healthcare and in with direct primary care. Like, how can I get all of these to work together for my company? That is really where Ty, Joe, and I come in. And if you have questions about your healthcare and about what your benefits are and how to kind of make this work, Ty is really the guy for that. So Ty, I'm going to give the floor over to you.
Yeah. One last thing, before I give you my information, one of the things that I did want to also that I didn't get into was the, whether you're questioning, should I reach out or not? How could this affect our business? It does not hurt you all to reach out to us and let us kind of give you a quick evaluation of where we think we could help you. And again, no matter if we're helping with the major medical or we're just helping with the DPC or the lifestyle wellness with Hope, there's other benefits that we can definitely help you with. We have a program where we're adding around $16,000 to $17,000 worth of additional benefits to each employee that you do have, without reducing their take-home pay and without costing you as a business owner anything as well. So, and there's some actual money that goes back to your guys' bottom line for that as well. So I want to throw that out there. Go ahead and make that call to us. My number that you can directly reach me at is 573-308-8059. My email address is ty at summitxadvisors.com. And then our website is www.summitxadvisors.com/trucking will also get you to, it will be up later today, but it will give you a landing site for us on our page too, and you can kind of search and see what we have to offer as well.
I really want to encourage you, if you're listening and watching the replay, to check that out, because we have some really awesome features coming out specifically tailored towards trucking companies. So if you kind of feel like you're just kind of a dime a dozen with your current broker or your current plan, Ty and his team have really done an amazing job making sure that we'll be able to give you back some real-time results as to what you could potentially save with your health insurance plan. So Dr. Joe.
Yes, you can reach me. My cell phone number is 501-230-0419. You can text or call that number. The best email address for me is Joe Duggar. It's JOEDUGGER @hotmail.com. And then the website is onelife.org.
Awesome. Well, we want to thank you guys so much for coming on. And if you have a question or a topic that you want us to dive deeper into in the coming months, please reach out to Nicole and the team and let them know. We're hoping to do a monthly health and wellness webinar on various topics. So this was just kind of our intro webinar, get to know Joe, Ty, and I, and kind of what we do, and just kind of dive into a little bit of each of these kind of topic categories. But we want to make sure that we're giving real value to you. So please reach out to Nicole and the team. Let her know there's no silly topic. If you're like, man, you talked about this, but I'm still confused, definitely let us know or reach out to us direct. And we would love to be your health concierge.
I love it. I love it. Thank you guys for being amazing partners. Just showing up and showing out. Just ensuring that we have a healthy community, because that's what it's all about. I thank you guys all for being here in person, eating lunch with us and learning. If you're catching the replay, man, you missed the energy in person. You got to catch the next one. All right. So make sure you're following us at www.aawta.org. We are so excited to have you for next month. And for those of you that are attending Mats, we'll all be there. So make sure you come by, catch us at Mats. We're excited to meet you. We want to meet you. Other than that, thank you. We'll see you next month. Bye, everybody.
Bye.
Thanks. Are we staying on for the debrief, Hope?
I think it's a separate link. Let me send that to you.
Okay.